I see so many patients in the office who have a question of, well, I tried this, I tried peptides, I tried low-dose naltrexone, I tried supplements, I tried this prescription medication, and it's not working. It means I need to do something else completely, or I have some other condition, and they go to Dr. Google and they go down a rabbit hole. It's great that you're being proactive about your health, but sometimes it's not the medicine, it's how the medicine was used. We see this a lot of times in inflammation conditions. We see this a lot of times in patients who have autoimmune conditions. We also see a lot of times when patients have been exposed to a toxin. This could be mold or heavy metal like lead, or it could be if you've been exposed to medicines called fluoroquinolones, like Cipro or Levaquin. Other cases we see it a lot is patients who have SIBO, small intestinal bacterial overgrowth. What's happening is it's kind of like, for a really cheesy analogy, it's kind of like whack-a-mole, is that if you're not hitting all the different spots at one time, unfortunately, you're not gonna feel better. You're not gonna feel the way you were before. For example, let's say with small intestinal bacterial overgrowth, you need to treat what's causing the small intestinal bacterial overgrowth. Is it an infection? Is it poor motility of the gut? Is it Lyme disease? So you need to figure out the cause. Then you need to deal with the immune component. Then you may need to address the diet. And then you need to get rid of the actual infection. And there may be some histamine release. It goes down the line and continuously down the line. So if you're not treating the gut and the immune and the cause at the same time, you may not get the improvement that you're looking for. Even though the doctors are doing the right treatment, they may be giving you Xifaxan, they may be treating the gut however they're treating it, glutamine, BPC, whatever they're treating. They may be treating you for your co-infection that caused it initially, but they're not fixing the gut health, they're not fixing the microbiome, and hence you're not getting better. The way I explain it to patients and what you need to be aware of is what we call the safety deposit box method. So for those who are old enough to know what a safety deposit box is, you need to turn all the keys at the same time. You need to have everything going at the same time rather than doing it piecemeal, because a lot of times it's not going to work, especially in a lot of these exposure type conditions like mold or SIBO, where if you're not treating the immune system, even though you're treating the infection, your body just is going to rebound and get the same issue going again. That is something that you need to understand, the healthcare provider needs to understand. So what you want to do, and I'm going to use 3 separate examples of what needs to be done. There are a lot of medications or supplements or peptides that you can use that can really help bridge the gap and have multi-purposes there. Let's go deeper dive into small intestinal bacterial overgrowth, since I already brought it up. So we want to treat the infection. 2 ways you can treat the infection. You can treat it with Xifaxan. You can treat it with the Candibactin AR and BR. You can do the dysbiocide, which are the herbals, maybe almost as effective. That's a starting point. You're treating the infection. Next thing you want to do is help heal the gut. That could be done with BPC 157. That could be done with glutamine and quercetin, which are herbal supplements. It could be done with colostrum. It could be done in a lot of different ways, but you want to be doing the gut healing with treating the infection and then looking for the cause. If it's poor gut motility, look at something like low-dose naltrexone. Low-dose naltrexone is one of those medicines I talked about, has a huge possibility because it does so many different things at the same time. It helps regulate the immune system. It may be a pro-motility drug to help the gut moving. It helps with inflammation. It does all those different things. It also helps with pain and has very little side effects associated with it. So it's a really good supplement to really get things started. BPC is another one of those that we'll get into in a little bit. So if you get 3 of those things going together, then you should get rolling in terms of treating the small intestinal bacterial overgrowth. That is kind of what we call the safety deposit box method, in the sense that you're getting everything going at one time. All the keys are moving, you're whacking all the moles at the same time. That's what you want to be doing in a complicated case. We're now going to talk about exposure to fluoroquinolones. Are antibiotics. The most common ones now are Levaquin and Cipro. They are used most commonly for sinus infections and urinary infections. And they have now what's called a black box warning, meaning that they do have some really serious side effects. They should only be used if other medications have not worked, or it has been shown that all the other medicines you're resistant to, meaning the infection will not respond to those medicines. What we know now is that those medications have multiple side effects in some people. Some people are more susceptible when they have genetic issues. Some people are more susceptible when they already have other ongoing issues going on. So what we see with patients who've been fluoroquinolones is that they will have histamine elevation or mast cell issues, which can cause bloating, brain fog, fatigue, headache. They also will have issues with their iron levels, which can cause fatigue and hair loss. They will have damage to their nerves. They will have muscle and joint pain. They will have clicking in their joints. They may have brain fog, inflammation, and some combination of the other factors going on. There's also a body's exposure to a toxin, which affects your immune system. When somebody's been exposed to something like this, you need to target all those different sectors at the same time, which means, again, target the immune system. We can go to our old school friend, low-dose naltrexone. We can use something like peptides like a thymulin, or we can use things like echinacea, the certain mushroom extracts that you can use. All those different things will help regulate the immune system. Part A. Part B, you want to stimulate the detox pathway. You can use something like an NAC. Third part is you want to decrease the inflammation. Again, we want to use something like a thymosin beta-4. BBC may or may not work if there's a histamine issue. You want to work on the neuropathy. That could work really well with PEA, or alpha lipoic acid, or a product called Neuroprotect, which is another supplement. If we want to target that, we're going to work on the brain fog. That could be treated with things like alpha GPC, or minocycline, which is an antibiotic that actually works really well in patients like this. Or you could use a peptide like dihexa, because your body is not going to reset and really heal in a continual way until you get there. Until you do all those things at the same time for at least a couple weeks, if not a month, to really establish that protocol. You got to turn all the keys, whack all the moles. I'm sure that'll be quoted somewhere now. One other really simple example is weight loss. Majority of our country is now obese. What do we do about it? What's going to work for Bob is not going to work for Jane. There's different reasons why patients are not losing weight. Could it be just because they're taking more than they're burning off? It's definitely possible. Is there gut inflammation? Or they have an elevated leptin? Is the microbiome altered? Is your insulin levels off? Are you allergic to gluten and that's causing an allergy, which is causing other side effects going on? Is there a female hormonal or male hormone issue? Do men have low testosterone? Do women have higher estrogen levels? Or low estrogen levels? Are they menopausal? Are they prematurely menopausal? Do they have low testosterone? All these different things could be combining and snowballing to cause an issue with weight loss. If the simple practice of doing some caloric restriction is not working, then you want to really work on doing the lab work, doing maybe a stool test, look for gut infections and other infections why you're not losing weight. And you may need to fix the hormones. You may need to calm down the insulin, get the insulin more sensitive through exercise or medication or supplements. You may need to heal the gut, work on the exercise routine. All those things together will get the body going in terms of losing weight. These are just 3 examples of what I call, again, the safety deposit box method. Turn all the keys, get things moving. Just fixing inflammation without addressing the immune system or healing the gut or dealing with the histamine response, it's not going to always work. Sometimes the body can just reboot on its own naturally. Sometimes you need to target all those things. The body is like a perfect run symphony when it's feeling good. If that symphony is missing the violin player and the saxophone and the drummer, it's going to sound crummy and your body is going to feel crummy. Things to listen to, things to be aware of. You may need to replace all those different things to get your body feeling the way that it wants to. Get yourself back to health. Any questions or comments, feel free to put them in the comment and question box. And if you like the content on the site, please feel free to like and subscribe and tell your friends so they can hear more.